Well, welcome everybody, and sorry I missed the first few talks, but the last couple I heard were great, and I'm looking forward to the other ones today. I just want to just say a few introductory remarks, and just to thank everyone here today for really what is an incredible showcase of talent, of expertise driving health and life science innovation here in Austin. You hear us often talk about the Life Science Innovation District and our desire to really continue to build and invest in that space with partnerships with the University of Texas, Dell Medical School, and across the campus and the city. I do want to have a special thanks to my colleagues who lead the Texas Health Catalyst and Discovery to Impact efforts. I don't know where Steve Eckers is. Where is Steve? He's got to be here. Oh, he's right in the front. Ruben, of course, so thank you for the introduction. Martin Rotman is there. Thank you, Martin. And Mark Arnold is possibly somewhere here as well. And really to the many others who have contributed so meaningfully to really bring us these initiatives along with events like today's. And I know I speak for all of the Texas Health Catalyst partners, UT's Colleges of Natural Sciences, Cockrell School of Engineering, College of Pharmacy, Discovery to Impact, and Institutes for Foundations Machine Learning teams, and of course, Dell Medical School and our own Center for Rare Diseases, when I say that the presentations we're seeing and hearing about today are really fantastic demonstrations of our potential to truly transform health and healthcare. And I think they also signal a critical component around the transdisciplinary nature of research. The big problems in health are not going to be solved by single disciplines. They're going to be solved by really these multidisciplinary teams. And there's really such a spirit here at the University of Texas. And I see Charlie Taylor sitting there too in the room. Our ability to really be able to recruit such top talent here, I think is a testament to that spirit of transdisciplinary commitment and collaboration. Today's finalists represent 5 of UT's colleges and schools, specifically pharmacy, natural sciences, engineering, the School of Information, Dell Med. Your ideas and the range of expertise that gave rise to them really powerfully demonstrates how we can meet the healthcare demands of the coming decades together. And the future of health is going to require inspired and empowered partners working in concert to really foster this culture of boundarylessness. That was a term that I used when I first came here. It's really a term that I would hear for the first time during my years at the Mayo Clinic before coming here. And it's really the idea that you're going to remove barriers to enable a convergence of talent, innovation, and knowledge. And I think that's what we're seeing here today. So cross-campus collaboration is really a defining opportunity unique to the university environment and an integral component of our efforts to establish a world-class academic medical center here in the largest U.S. city without one. You might wonder, what are we talking about? I mean, you would think that we would have a large academic health system, but in fact, we don't yet. And we have the medical school, we have this amazing flagship university, we have schools of nursing, schools of pharmacy, these other schools, but our moment is now to really not only invest in bringing a new hospital, building that hospital together with our partners with MD Anderson in close collaboration with the UT system. But in addition to really expand our footprint in healthcare, that includes expanding and bringing over 300 new physician and physician scientists over the next 5 years, in addition to expanding our ambulatory practice, and most importantly, to not lose sight of the academic mission, which involves education, research, and entrepreneurship. There's a reason that my first scientific hire as a dean was Steve Ecker. And what role did I appoint him in and ask him to come here for? It was to become the Associate Dean of Innovation and Entrepreneurship. That would be the first external hire that I would make. And that really hopefully signals how I and we here at UT and at Dell Med view that to be so central to create that entrepreneurial mindset that we see on display here today. So last year, Dell Med released its strategic plan for the University of Texas, where we set forward a bold vision of defining the future of health. And we understand the importance of digital data, technology, innovation, entrepreneurship to advance that future. And when we hear President Hartzell and others talk about what starts here changes the world, we like to lovingly say that health starts here. And the idea that we are focused on real world impact to address real world problems, which is really central to the Texas Health Catalyst theme. The vision demands that we set the standard of excellence in integrated patient-centered care, pioneer research with meaningful impact, lead innovation in medical education, and catalyze life science entrepreneurship, all while working together with our community, as well as training the future of healthcare leaders and powered by cutting-edge technology, data, and digital capabilities. This is really not about us just building another hospital or two to compete in the Austin market. This is an investment that will put our community and our healthcare ecosystem on the map and a new way to attract patients and partners who previously may have gone elsewhere, or if they were here, went without. And when we're building this hospital, we brought alongside SOM, the architect, together with MD Anderson as one architect. And we also brought on board Largo, Landgren and Argo, our 2 futurist consulting teams that are working alongside, and several of the teams here have been able to be interviewed by them and get input, because we're really trying to plan for the future and think about what health is looking like as many disruptions are happening in that space. So with that, I think it's exciting to continue to lean in and hear from all of you. We envision that UT Medical Center is going to be a thriving hub for an integrated academic health ecosystem, and is actually a living laboratory for healthcare innovation to improve and save lives. 2 years ago, my time started here, and I remain convinced since that time that we're one of the few cities uniquely prepared to do this work. The tremendous convergence of university talent, the medical school, all the colleges across the campus, schools across the university, the private sector, the tremendous technology environment we have here, at a time when we really have this greenfield opportunity to really build and structure this together almost from the ground up. And that is a unique opportunity at our hands here. Collectively, I believe we have the right team in the right place at the right time to establish Austin as a premier destination for both healthcare and innovation, a vision I know is shared across this room. So Texas Health Catalyst is one of Dell Med's earliest initiatives. It preceded my arrival, and it already showed that spirit of innovation entrepreneurship. It plays a key role in accelerating our shared vision by providing real-world validation, leveraging UT's world-class academic research, Dell Med's clinical enterprise, and Central Texas's innovative environments to identify and accelerate promising research through industry and clinical expertise, strategic partnerships, seed funding, publicity and showcase opportunities, entrepreneurship skills development, and startup support. Our early and ongoing investment in health and life science innovation entrepreneurship is central to our identity as an academic medical center and to UT's positioning as one of the world's highest impact public research universities. From the beginning, Dell Med prioritized innovation in medical education, and I see Dr. Jim Korndorfer here, who is our new Vice Dean of Education. Just brought him from Stanford to join our team. I think today is day 3 of the job, so we're excited to have you here. But again, I think from the beginning, we want to continue to instill in our future physician leaders the knowledge and experience and motivation to act as agents of innovation, not just change. And when you talk to Dr. Korndorfer, you'll hear about his work in innovation on the GME space and the simulation center. And it was just one of those, again, that entrepreneurial spirit that is drawing leaders here and hopefully being part of this culture. You can find that innovation mindset across our curriculum for the medical school, from the emphasis on leadership and innovation as a core competency in our MD program, to the time we carve out in our unique 3rd year of study for students to focus on a range of interests, including clinical innovation and design. We've built a national reputation specifically on this program, and Texas Health Catalyst provides an experiential learning platform to our up-and-coming physician leaders, offering support for turning groundbreaking ideas into real-world solutions to faculty, residents, fellows, and students. And I know of nowhere else, no other medical school program in the country, frankly, that has their 3rd year really devoted to the possibility of pursuing not only an advanced degree, but to dive deeper into this entrepreneurial space, and look forward to continue to partner with the office led by Steve Ecker and Martin and others on the curriculum to complement and supplement, together with our other schools, this entrepreneurial activity. So what's new as we move into our next chapter is the opportunity for UT Medical Center not only to provide world-class integrated care for people in Central Texas and beyond, but to serve as an innovation validation engine, not just a living laboratory, but a platform for evidence to flourish, a place where a hospital of the future, intentionally designed to accommodate radical advancements, becomes the incubator for rapid adoption of now proven innovations. So finally, Texas Health Catalyst takes the unique facets of academic medical center, the convergence of education, patient care, and research, and joins them with more than 300 clinical and industry advisors, building Austin's health and life science innovation ecosystems, even as it leverages them. So this today is one of the ways we get from discovery to impact, from groundbreaking idea to real-world solution, from vision to reality, and from what starts here to what changes the world. So I really want to thank everyone for participating. This is a great turnout. I look forward to hearing more of the talks, and I want to congratulate you all, offer best of luck to the finalist teams, and if there's any time for any comments or questions, but I'm happy to take those as well. So thank you, everybody.